Good evening. My name is Dr. Late Night. It's wonderful to see you again. So I see that you're here today for a cognitive screening test. Okay, great. And I have a note here that you want me to especially focus on your memory today. Is that right? Okay, great. So I have a series of questions and tests for you just to make sure that your brain is working well, which I'm sure it is. But it's very important to make sure once in a while, just so that you don't miss anything if you are having issues. Okay, great. So, can I get your full name, please? Okay. And what is your date of birth? Okay, great. And of course I can work it out myself, but how old does that make you? Okay, great. Can you tell me today's date? Okay. And what time of day is it? What hour of the day? Okay, wonderful. And what day of the week is it? Can you remember that? Okay. Alright, great. So those were some basic questions. I'm going to move on to some memory related questions now, if that's okay. Great. And there are just 4 of these, and then we will move on to the tests, okay? So firstly, do you ever forget what day it is? Okay. Do you often walk into a room and forget why you're there? Okay. Yes, these things happen to everybody on occasion, but we're looking for a pattern here to see if there are any issues. Okay. So don't be shy, just answer whatever comes to mind. Okay? Alright, and do you ever find yourself forgetting important obligations like appointments? Okay. Okay. Obviously you didn't forget our appointment today, so that is a great sign. And my final question for you is, do you ever have trouble getting your words out or finding the right words? Maybe you feel like a word is on the tip of your tongue, but you can't quite find it. Does that happen often? Okay, great. Wonderful. Now I have 3 things that I would like you to remember, and I'm going to quiz you at the end of our exam today, okay? So I'll repeat them a couple times for you. First thing is a red rose. The second thing is a black puppy dog. Okay, and the third is 1200 North Broad Street. Okay, so I'll repeat those one more time, and then I'd like you to say them back to me, okay? So, a red rose. Good. A black puppy dog. And 1200 North Broad Street. Can you repeat those back to me, please? Okay, great. And just try to keep those in your head, as I will be quizzing you on them at the end of our assessment, okay? Okay, great. So next up, I'm going to ask you to do a few basic things, answer a few questions. They may seem silly to you, but we're just covering all of our bases here, okay? Okay, so without looking in the mirror, what color are your eyes? Okay. Now I would like you to count from 1 to 10 for me, please. Okay? Great. Easy enough, right? Okay. Now I want you to count from 10 down to 1 for me, okay? Okay. Wonderful. Now, can you please tell me what the 12th month of the year is? What is the 12th month of the year? Great. Okay, and what is the 6th month of the year? Okay, wonderful. Of course, the 12th would be December, the 6th would be June. Very good. Okay, next up, can you remember what you ate for dinner last night? Okay, good. And what did you eat for dinner the night before that? Okay, great. Now I'm going to give you a few basic math problems. They shouldn't be difficult, nothing that you need to write down, okay? So the first problem is 6 plus 8. What is 6 plus 8? Great, that is 14. Next, what is 9 minus 3? Okay, good. Of course, that is 6. The next problem is 20 times 7. What is 20 times 7? Great, 140. Very good. Now my final problem for you is a two-parter, okay? So first, I want you to tell me what 3 times 2 is. Great. And then add 4 to that. Okay, good. 10. Very good. So next up, we're going to play a little association game, okay? So I'm going to give you 2 things, and I want you to tell me how these 2 things are alike. Ready? The first 2 items are an apple and an orange. How are those alike? Great. They are both fruits. Okay. Next up are a plane and a train. How are they alike? What do they have in common? Great. They are both forms of transportation. And the final pair for you is a painting and a symphony. A painting and a symphony. What do they have in common? Okay, great. They are both works of art. Very good. Okay, next up, I'm going to have you do a few basic things related to identification, okay? So first, I want you to just touch your nose, okay? Great. Easy peasy. You can relax. The next thing I would like you to do, please, is to point to your right foot. Okay, great. You can stop. Now, the final action I would like you to perform, please, is to show me your left pinky. Your left pinky finger. Okay, great. Good. Now I'm going to set my paper to the side here. And I have a few things I would like you to identify for me. So I'm going to show them to you, and I just want you to identify them, okay? What is this? Good, it is a hairbrush. Okay. What is this? Great, can you spell this for me? Good, S-T-O-P. Okay, and what does that spell? Very good. And now I want you to tell me what shape is this? How many sides does it have? 1, 2, 3, 4, 5, 6, 7, 8. So it would be an octagon. Very good. Okay. Can you tell me, please, what this is? What is this? Good. It is a lighter. Okay. Now I just want you to identify a few colors for me, okay? So I have these little balls here. Can you tell me what color this is? Good. Blue. What color is this? Purple. Good. What color is this? Great. Yellow. And what color is this? Good. Red. Now I'm going to hold up 2 at a time, and I want you to tell me what 2 colors are displayed, okay? Ready? Good. Good. Great. Perfect. Okay. That concludes the identification portion of our exam. Okay. Next up, I have a few words for you that I would like you to spell for me, okay? These shouldn't be too difficult. Just take your time though, alright? The first word is shelf. Shelf. Great. Now I want you to spell the same word, shelf, but please give it to me backwards. Okay. Great. That can be a little bit tricky, but we're testing your concentration here. Okay. Next word is brain. Brain. Can you spell that for me? Okay. And can you spell out brain backwards for me, please? Great. Okay. The final word is phone. Phone. Can you spell that 4 words for me? Okay, great. Now, can you spell phone backwards for me, please? Wonderful. Okay, so next I'm going to have you observe this. We'll call it a chart here. So we have a yellow square, an orange triangle, a blue circle, a purple square, a green square, and a blue triangle. We also have a group of 5 dots here, a group of 6 dots, and a group of 3 dots. Okay, so I just want you to take this in. I'm going to show it to you for a little bit, and I want you to try to memorize it as best you can, okay? Just a few more moments. Try to take it in. Okay, great. Now, I'm going to ask you a few questions relating to what you just saw. Okay, so how many blue shapes did you see? Okay, can you remember what they were? Great. What was the color of the only circle on the page? Great. In the middle bottom row, how many dots were in that cluster? In the middle of the bottom row. Great. Can you remember what color the 2 triangles were? Okay. And can you recall how many dots total were on the page? Great. My final question is, what color was the pointer that I used to display each of the shapes to you? The pointer. Wonderful. Okay, great. Okay, I have a few more tests for you, mostly pertaining to your short-term memory, okay? So I want you to listen closely. Firstly, I need you to tell me 2 items that you might find in a classroom, okay? 2 items. Great. There are so many different things you could pick for that, but those are perfect. Next up, can you tell me 3 foods or 3 dishes that begin with the letter S? Okay. Take your time. Good. Sushi is coming to mind for me. Squash. Great. One more. Okay, perfect. And finally, I need 2 animals that begin with the letter M. M. Good. Okay, perfect. Okay, now I'm going to give you a list of 5 items, and I'm going to have you repeat them back to me after 10 seconds, okay? I will repeat this list twice. The items are milk, sofa, beach, shirt, paper. One more time. Milk, sofa, beach, shirt, and paper. And I'm going to wait 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Can you repeat those items back to me? Great. Okay, perfect. Now I'm going to tell you this list one more time, and then we will wait 15 seconds, and I'll have you repeat it back once more. Okay? Again, the items are milk, sofa, beach, shirt, paper. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. And repeat them back to me, please. Great. Perfect. That is excellent. Now I'm going to give you a list of 5 numbers, and again I will have you repeat them back to me after 10 seconds, okay? The numbers are 6, 12, 5, 21, 7. One more time. 6, 12, 5, 21, 7. And we'll wait 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And what were the numbers? Great. Yes, 6, 12, 5, 21, and 7. Very good. I have one more list for you of 5 numbers once again, and these I'll have we wait 15 seconds before repeating them back. This is the last one, okay? The numbers are 20, 15, 3, 9, 4. One more time. 20, 15, 3, 9, and 4. We'll wait. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. And what were those numbers? Great. Perfect. They were 20, 15, 3, 9, and 4. Very good. Now, my final question for you is, do you remember the 3 things that I told you to remember in the very beginning of our exam today? Good. Red rose. Yep. Black puppy dog. Do you remember the last one? Excellent. It was 1200 North Broad Street. Very good. Okay. You have done very well today. You passed your exam with flying colors. I don't have any concerns about your memory, short-term, long-term, or your focus or attention. Yes, you did very well. You passed every test. I have no worries, okay? Thank you so much for coming into the clinic today. hope that you have a great rest of your day, and I hope to see you again soon. Thank you so much. Good night.